Okay, so welcome everybody to the Genius class. Today we'll be looking at the prescribing oxygen. Okay, so let me share the screen. Good, and we make the presentation bigger. Okay, good. So, Genius class 2023, prescribing oxygen. So, prescribing oxygen. Let's look at the main points first of all. We're going to look at the main points first of all. So, oxygen should be regarded as a drug. Oxygen should be regarded as a drug. It is prescribed to hypoxic patients to increase their alveolar oxygen tension, and by so doing, to reduce, of course, the work of the patient. Okay, the concentration prescribed required depends on the condition. So it depends on what condition you're prescribing for. Administration of inappropriate concentration of oxygen can have serious or even fatal consequences. Now, let's look at oxygen saturations. In acutely unwell patients with a normal or low arterial carbon dioxide, oxygen saturations should be 94 to 98%. So where there is no CO2 retention, normal or low arterial carbon dioxide, the oxygen saturation should be 94 to 98. In some clinical situations, such as carbon monoxide poisoning or cardiac arrest, it is appropriate to aim for highest possible oxygen saturation. For example, aiming at 100%, in carbon monoxide poisoning. A lower target of 88 to 92% of oxygen saturation is indicated in patients at high risk of hypercapnic respiratory failure. In other words, where there is risk of what? CO2 retention. The common example is COPD. So we need a lower oxygen saturation target of 88% to 92%. Let's look at examples of high concentration oxygen therapy. Okay, so high concentration oxygen therapy is safe in uncomplicated cases of the following condition. So in these conditions, if it's not complicated, then high concentration is safe. Okay, so pneumonia, pulmonary thromboembolism, pulmonary fibrosis, shock, for example, hemorrhagic shock due to bleeding, severe trauma, sepsis, anaphylaxis. What is a high concentration? We are talking about 94 to 98% oxygen. Low concentration oxygen therapy is reserved for patients at high risk of hypercapnic respiratory failure, where high risk of CO2 retention. Here, commonly it is what? A COPD. Okay, but other conditions to be aware include the advanced cystic fibrosis, severe kyphoscoliosis, or severe ankylosing spondylitis, severe non-cystic fibrosis, bronchiectasis. Okay, the common one we're going to meet in exams is a COPD. That's why we're going to need what? Low concentration. What do we mean by low concentration? 88 to 92% oxygen saturation. Okay, so the next we'll look at oxygen delivery devices. Oxygen delivery devices and the flow rate. This is what we need to understand. So theoretically, let's look at them. Oxygen is delivered from taps above the ward beds, at 100% concentration. So delivered at 100% concentration. It is then put through different devices and flow rates. Okay, it's put through different devices at different flow rates to adjust the oxygen concentration that the patient inspires. So initially it's delivered at 100% concentration, then you choose the device and the flow rate to adjust to the exact oxygen concentration, oxygen saturation that is needed. The percentage of oxygen inspired depends on the flow rate and the device used. Depends on two things, the flow rate and the delivery device. So they're the two things that you need to know, the flow rate and delivery device. The flow rate can be set on a ward tap, okay, and the flow rate could be 0 to 15 liters per minute. So the flow rate is per minute, either 0 to 15 liters per minute. The delivery devices, okay, are different. So delivery devices are different and they work with different flow rates. They include things like what? Nasal cannula. Okay, so let's look which devices exist. One is a nasal cannula. Okay, here, this is an example of a nasal cannula in here. So nasal cannulas, they deliver oxygen at 24 to to 30% oxygen, delivers 24 to 30%. This is important for you to understand. The flow rate is 1 to 4 liters per minute. 4 liters will dry the nose, so 2 liters is more comfortable. So when you're using a nasal cannula, you use what? You use 2 liters. It will deliver anywhere between what? 24 to 30%. So what's the percentage concentration? 24 to 30%. And what's the flow rate? 2 liters. It is used in what situations? In a non-acute situations, or if only mildly hypoxic patient. For example, a patient with pneumonia has got saturation of 92%. Okay, so you want to increase the oxygen, so you may use a nasal cannula. So usually use in non-acute. For example, patient that needs the long-term oxygen therapy at home, they'll use a nasal cannula. Just to remember, it will deliver oxygen 24 to 30%. Okay, better to use a 2 liter. Okay, and it is used in non-acute situations, or if only mildly hypoxic. Yeah. For example, patient is stable and at 92% oxygen without, okay, good. So venturi masks are the next one. Now, what you see on the screen here, these are the venturi masks. As you can see, they've got different colors, yeah? Different colors is what you can see in here. Each color delivers a different concentration of oxygen. And on each of these venturi, it will tell you actually how many, how many liters per minute you need to use, yeah? How many liters per minute you need to use. So let's have a look in here. Venturi mask, they deliver 24 to 60% of oxygen, 24 to 60%. Different colors deliver different rates. So the flow rates varies with the color, okay? The correct flow rate to use with each color is shown on the mask. So on the mask is written, okay? Along with the percentage of oxygen delivered, along with the percentage of oxygen delivered. So let's look in here. The blue one, for example, okay, the blue one, you use 2 liters, it will deliver 24%. The white one, you use 4 liters per minute, it will deliver 28%. The yellow one, 8 liters per minute, deliver 35%. The red one, 10 liters per minute, deliver 40%. Green one, 12 liters per minute, delivers 60%. So first you have to remember, you know, that eventually mask will deliver 24% or 28% or 35% or 40% or 60%. Then you have to remember the liters that will give you this percentage. So just to make it easy, we're going to say 2 liters, 24, 4 liters, 28, 8 liters, 35, 10 liters, 40, and 12 liters, 60, because it delivers from 24 to 60%. Venturi masks are often used in what? In COPD, where it is important not to over-oxygenate the patient, not over-oxygenate the patient. Okay, one more time. So the different colors, they give a different concentration and a different flow of oxygen. This one here is a non-breathing mask. As you can see, it has got a bag. Okay, and remember that non-breathing mask, they deliver oxygen at 85 to 90%. It does not deliver 100%, which is a common mistake. So 85 to 90%. You know, what rate? 15 liters per minute flow rate. A bag on the mask with a valve, stopping almost all rebreathing of expired air. So when you breathe out, you don't rebreathe it again. That's why it's called what? A non-rebreather mask. It is used for acutely unwell patients. Note that saturations should be maintained at what rate? 94 to 98%, not 100%. Do not keep a patient on 15 liters flow longer than necessary, as over-oxygenating for prolonged periods can also be harmful. So a non-rebreathing bag offers 85 to 90%. You have to put what? 15 liters per minute flow. Okay, it's used in acutely unwell patient, maintaining the saturations concentration of what? 94 to 98%. Now, let us prescribe the oxygen. First of all, there are 4 steps in oxygen prescribing. Just remember the 4 steps when you go on the drug chart. The oxygen target saturations. What is the target saturations? It's given on a drug chart. You have to circle it or write. For example, if it's 94 to 98, circle it. If it's 88 to 92, you circle it. If it is other, you write, for example, 100% if in carbon monoxide poisoning. So once you have circled the saturations, the target saturations you need. Number 2, the next step is the frequency. Is it PRN only when required or continuously? Then you cycle continuous, for example, in an acute setting. Device and the flow rate. Okay, now choose the device and choose the flow rate. Yeah, we discussed that before. For example, if it's an annual breathing bag, you cycle annual breathing bag. And what's the flow rate for annual breathing? 15 liters per minute. Venturi mask, okay, you need to choose it. You cycle the venturi mask. And then what's the flow rate? We said you can give it 2 liters. It will give you 24. 4 liters will give you 28. Okay, and of course, 8 liters will give you 35. 10 liters will give you 40, 12 liters will give you 60, plus you must choose the right color of the what? Venturi mask. Nasal cannula, we're going to give you at what? 2 liters for the nasal cannula and non-acute setting, or if there is no venturi mask, because it can give you what? We said 24 to 30%. So step number 3 is to choose the device and to choose the flow rate. Step number 4 is the prescriber's details. Write your signature, write your name, your blip, and date. So there are 4 steps. What's the oxygen target saturations? Cycle it. What's the frequency? PRN or continuous? What's the device? Choose the device and choose the flow rate. Device and the flow rate, they go together. Device and what's the flow rate? You can't just choose the device. You must also choose the flow rate. And lastly, number 4 is the prescriber's signature. You must details, your signature, your name, your blip, and your date. Okay, so let me show you this on a drug chart itself. So this is on a drug chart. If you look on the screen, so you see here, oxygen prescribing. What does have a year? We have to write the year in here and put a date or month in the boxes as usual. Then they're telling us here what's next. Tick or insert the times required. If we need it all the time, we're going to cycle everything: morning, midday, evening, bedtime, if it is continuous. Then saturations, you see in here. So we said the first step is it cycle target oxygen saturations. Is it 94 to 98? You cycle, or 88 to 92, 92, cycle. Other, you need to write here. What was step number 2 that we discussed? Okay. Next is the device. What's the starting device and the flow rate? You see here, starting device and the flow rate. Now in here, they are written, so we need to write there. In here, we have to write. You see, they are written here: venturi mask, VM, simple face mask, SFM, humidified, H, and non-breathing mask, NRB, nasal cannula, and C, humidified via trachea mask, TM. So which one do we need? We need a non-breathing mask. You write here, non-breathing mask. Okay. So in here, starting device, please, non-breathing mask. What's the flow rate? In front of it, you write 15 liters per minute. Okay. If it's a venturi, you write venturi mask. How much oxygen you want to give? You want to give 24. So you're going to say 2 liters. Venturi mask, 2 liters. Then they will choose the right color and use it. Tick here if saturation not indicated. If there's no targeted saturations, then you tick. In our case, it will be choosing. And step number 4, what's going to be? Prescriber's details. Write your name, print your name clearly, your blip number, and of course, your date in here you have to put. Okay, so you can see in here, it is easy to prescribe. One more time, what do? You target saturations, please choose the device. Choose the device and choose the flow rate. And then you choose, is it a PRN or continuous? You cycle here. If it is as required, you cycle. If it's continuous, you cycle, it is continuous, then it is done. Okay, we just have to cycle, it's continuous. Okay. And the prescriber signature, we put of course, our name, signature, date, and the blip number. Okay, then we are done with the prescription. So what we're going to do now, let's try to do the prescription. Let us write here so that we can see how we can write this. Okay, so we're going to try to do that now. Good, so you can see on the screen here, now we have to prescribe oxygen. Okay. So what we're going to do, it says year here, easy, what's the year? 2023. Good. It says the date and the time. So we're going to put the date. Today is what? 27 to 28 to 29 to like that. SECO, target station. Okay. If a patient has pneumonia, for example, we're going to SECO here. Gas saturation. Starting device is a non-rebreathing mask. Okay, non-rebreathing. Mask. And the at what? 15 liters per minute. What you can see in here for us is a, let me just write this again so that it is more clear. So it's a, yeah, they've given his the abbreviation in here. You see device code. So I'm just going to use a device code, which is going to be non-rebreathing mask, and it's going to be 15 liters per minute. Okay, next, continuously or PRN continuous. So it's continuous for now. Yeah, prescriber signature, you put your name in here. What's the name? Amani Khan Blip 7777 for figures. Date is 27 to 23, and all we have. We are doing a continuously oxygen here for us. So there is no issues. So we have prescribed, and we put the signature here. Make sure you have signed it. Okay, so that's how we do prescribe. Now, if the patient needs, for example, the COPD, okay, so I'm going to rub this. All right, so now let's do the COPD, for example. Again, we start 2023, okay, 27 to 28 to, yeah, 1 3 1 2 3 3 3, for example. So it says it target saturations as a COPD we aim 88 to 92. What device we use is a Venturi. You see here it's the Venturi mask, which is a you can write a Venturi mask, just need to write in small handwriting. Venturi mask. Okay, and how much going to give the patient? 24% is 2 liters. So we're going to put it 2 liters per minute. Okay, if I want 28, then I'll put 4 liters per minute. Is it continuously or as required? If he prescribe oxygen as required, if it drops, then I'm going to say as required. I will say as required. Okay, signature here. Again, we said Amal Khan. Okay. Print the 1 in capital letters. Okay, so we need to print in capital letters this one. So here we go. Let's do it in capital letters. Khan, because they want us to print 7777. The date is 27 to 23, and we are done. So that's how we would prescribe our oxygen. Okay, good. So I'm gonna stop sharing from there, and we're just gonna recap now that we have looked at that. We'll look at the many steps one more time. Oxygen target, please, SECO 98. So let me share the screen one more time. Yeah, let's look at the screen one more time. So first step, oxygen target saturation, choose. Frequency, PRN continuous, choose. Device, choose the device and say the flow rate. Prescriber's details, and you put it there. Then we are done. Thank you.